Antimicrobial resistance, or AMR, is a growing global threat. Infections are becoming harder to treat as bacteria develop resistance to antibiotics. This resistance leads to prolonged illnesses and increased healthcare costs. Beyond these consequences lies the stigma associated with AMR infections, like MRSA. MRSA evokes fear and misunderstanding. People associate it with uncleanliness and contagiousness. This stigma leads to social isolation and psychological distress. Dr. Gudrun Lind highlights the profound impact of this stigma. The invisible wounds can be as debilitating as the infection. Starting in the late 1990s and early 2000s, Sweden, like many other countries, experienced a surge in MRSA cases. This increase led to heightened awareness and, unfortunately, increased stigmatization. People diagnosed with MRSA were often treated differently, facing isolation and prejudice. The stigma surrounding the infection began to permeate various aspects of Swedish society, impacting healthcare, workplaces, and even schools. Parents were hesitant to send their children to schools where MRSA cases had been reported. Healthcare workers faced discrimination, and individuals diagnosed with MRSA often concealed their condition, fearing judgment and social repercussions. The stigma surrounding MRSA had become a public health issue in itself, hindering efforts to control the spread of the infection. In 2009, Sweden took a bold step to address the growing stigma associated with MRSA. The country launched an initiative to undiagnose asymptomatic MRSA carriers. This meant that individuals who tested positive for MRSA but showed no symptoms were no longer considered infected. This groundbreaking decision was based on scientific evidence, showing that asymptomatic carriers were not significant spreaders of the bacteria. This policy shift aimed to reduce unnecessary anxiety, fear, and discrimination associated with the MRSA diagnosis. By shifting the focus from identifying and isolating carriers to preventing transmission among those with active infections, Sweden aimed to create a more compassionate and effective approach to managing MRSA. The decision to undiagnose asymptomatic carriers was a paradigm shift in MRSA management. It challenged the prevailing perception of MRSA as a highly contagious and dangerous infection. This change in approach reflected a growing understanding of the complexities of MRSA transmission and the importance of focusing on evidence-based practices. Section 4. Education and Empowerment. Changing the narrative on MRSA in schools. Sweden's efforts to combat the stigma of MRSA extended beyond policy changes. The country implemented comprehensive public education campaigns to raise awareness about MRSA and dispel myths surrounding the infection. These campaigns emphasize that MRSA is a common bacteria and that most people who carry it do not become ill. The focus shifted to promoting hygiene practices that prevent the spread of all infections, not just MRSA. Educational materials were distributed in schools, healthcare facilities, and public spaces. The government worked closely with healthcare professionals to provide accurate and accessible information to the public. Furthermore, Sweden updated its recommendations for children with MRSA attending school. Children with asymptomatic MRSA were no longer excluded from school or required to take special precautions. This decision was based on scientific evidence and aimed to create a more inclusive and supportive environment for all children. Sweden's example in combating stigma and AMR. Sweden's comprehensive approach to addressing MRSA stigma serves as a model for other countries. By combining evidence-based policies and public education, Sweden has reduced fear and discrimination. Tackling stigma is crucial for effective public health policy. Sweden's journey provides valuable lessons for the global fight against AMR.